Log rolling. Introduce yourself and verify the client's identity. Explain to the client what are you going to do and how the clients can cooperate. Perform the hand hygiene and observe other preparation, infection prevention procedure. Provide a client's privacy. Position yourself and client appropriately before place the client's arm across the chest. Pull the client to the side of the bed. Use a draw sheet to facilitate the log rolling. First, stand with the other nurse on the same side of the bed. Assume the board stand with one foot forward and grabs the roller edge of the draw sheet. On a signal, pull the clients toward both of you. One of the count 1, 2, 3. Then, the same time, all the staff pull the client to the side of the bed by shifting with the weight of the back of the head. One person move to the other side of the bed and place supportive device for the client when they turn. Place a pillow where to support the client's head after the turn. Place 1 or 2 pillows between the client's legs to support the upper leg when the client is turned. Roll and position the client in proper alignment. Go to the other side of the bed, farthest from the client, and assume the stable stance. Reach over the client, grabs a draw sheet and roll the clients towards you. The nurse count 1, 2, 3, and then at the same time, all the nurse roll the client to the lateral position. The second nurse behind the client helps turn the client and provide pillow to support the ensure good alignment in the lateral position. Support the client's backward, upper, and lower extremity with pillows. Raise the side rails and place the cowbell within the client's reach. Document all relevant information record. Moving up the client. Prior to the performance, the procedure, introduce yourself and verify client's identity using the agency protocol. Explain the client what you're going to do, why it is necessary, and how the client can cooperate. Listen to the suggestion made by the client or supporting people. Perform the hand hygiene and observe other appropriate infection prevention procedure. Provide client's privacy. Advance the bed in the client's position. Adjust the head of the bed to the flat position or as low as the client can tolerate. Raise the bed to the height appropriate for a personal safety. Example as the caregiver elbow. Look at the heels on the bed and rise the legs on the side of the bed opposite you. Remove all pillows when placed one against the head of the bed. For the client who is able to reposition without assistance, place the bed in the flat or reserve tender boards position or tolerant by the client. Stand by the structure the client or move self. Assess if the client is able to move without causing friction to the skin. Encourage the client to reach up the grabs of the upper side rails with the both hands. Bend knees and push up the feet and pull up with the arms stimulously as if position device is needed. For the client who is partially able to assist. For the client who weight has less than 200 pounds, use a friction-reducing device or two assistants. And the client who is weight less than 201 to 300 pounds, use the friction-reducing slide sheet and 4 assistant or an air transfer tube assistant. For the clients who weigh more than 300 pounds, use an air transfer system and 2 assistants on the total transfer sleeve. Ask the client to reflect the hip and knees and position the feet so they can be used effectively for pushing. Place the client's arm across the chest as the client flex the nurse. Place the client's arm across the chest as the client to flex the neck during the move and keep the hand of the bed surface. Use the friction-reducing device, draw sheet, and assistant to move client up in the bed. Ask the client to push on the count of 3. Position yourself approximately and move the client. Face the direction of the movement and then assume the board stand with the foot nearest the bed behind the forward foot and weight of the forward foot. Lean your tongue forward with the hips, flex hips, knees, and ankles. Tighten your gluteal and abdominal leg and arm muscle and rock from the back leg to the front leg and back again. Then shift your weight to the front leg of the client, pushes with the heels, and the clients move towards the head to be assist. For the client who was unable to assist, use the ceiling lift with the supine sling or mobile foot Floor base lift to the 2 or more caregivers. Follow the manufacturer guideline for using the lift. Ensure the client's comfort. Elevate the head to the bed and provide approximate support device for the client's new position. Document all the relevant information. Assisting a client to the seat of the bed. Introduce yourself and verify the client's identity. Explain to the client what you're going to do and how the clients can participate. Perform the hand hygiene or observe the appropriate infection prevention procedure. Provide a client's privacy. Position yourself and the client approximately before and move. Assist the client to lateral position facing you using the assessive device depending on the client's assistant needs. Raise the head of the bed slowly to its highest position. Position the client's feet and lower legs to the edge of the bed. Stand beside the client's hips and face the far corner of the base. Stand beside the client's hip and face the far corner of the bottom of the bed. The angle in the which movement will occur. Assume the board stand. Place the foot nearest the clients and head to the bed towards. Lean your trunk forward from the hips. Flex your hips, knees, and ankles. Move the client's or the sitting position using an assessive device depending on the client's assistant needs. Place the arm nearest to the head of the bed under the client's shoulder and the arm over both of the client's thighs near the knees. Tighten your gluteal abdominal leg and arm muscle. Pivot on the balls of your feet in the described direction facing the foot of the bed while pulling the client's feet. Keep supporting the clients until the client's well balanced and comfortable. Assessive vital signs, pulse, respiration, and blood pressure as indicated by the client's health status. Document all the relevant information. Turning a client to the lateral or prone position in bed. Introduce yourself and identify the client's identity. Explain to the clients what you're going to do and how the clients can participate. Perform the hand hygiene and observe other appropriate infection prevention procedure. Provide the client's privacy. Position yourself and the clients approximately before the move. Other individuals stand on the opposite side of the bed. Adjust the head of the bed to the flat position or as low as the client can tolerate. Raise the bed to the height approximately for the personal safety, a caregiver elbow. Lock the breakers on the wheels of the bed. Move the clients closer to the side of the bed, opposite to the side of the bed while the patient is turned. While standing to the other side of the bed, nearest to the client, place the client's near arms across the chest. Abduct the client's far shoulder slightly from the side of the body and extremely tolerate the shoulder. Place the client's near ankle and foot across the far ankle. The person on the side of the bed towards which the client will turn should be positioned directly to the client with the client's waistline as close as the bed is opposite. Roll the clients to the lateral position in second person. In the second person, stand on the opposite side of the bed. Helps roll the clients from the other side. Place the hand on the client's far hip and the other hand with the client's far shoulder. Position the clients on the side or her side with arms and leg positioned and supporting properly. Variation. Turn the clients to the prone position. To the turn the client to the prone position, follow the preceding step with the two exceptions. Instead of abducting the arm, keep the client's arm alongside the body for the client to roll over. Roll the clients completely onto the abdomen. Documents all the finding information.